Hello everyone, welcome to Pathomed. Today let us study about one of the autopsy techniques of the heart, that is the inflow and the outflow method of the autopsy technique. This is one of the autopsy techniques of the heart. This video I have uploaded many months ago and this is the most watched video of our channel. One of our subscribers have asked for diagrammatic representation. He needed a much detailed explanation for this method. So before beginning, let us study the anatomy, basic anatomy of the heart, and this technique is separate for each chamber, each side of the heart. Right and left side, they are dealt separately. For the right side of the heart, we'll see the basic anatomy. This is the anterior surface of the heart. On the anterior surface, you can visualize the right auricle or the right atrial appendage, which is nothing but a muscular extension of the right atrium. Within this right appendage, atrial appendage, you have right atrium. This is the right ventricle. This is the right ventricle. In between the two ventricles on the anterior surface is the anterior interventricular septum. Since it is present on the anterior surface, in between two ventricles, the groove is given the name anterior interventricular septum. This is the IVC, inferior vena cava. This is the superior vena cava. This is the pulmonary trunk, the main pulmonary branches and pulmonary trunk. On the posterior surface, this is the posterior surface of the heart. Here you can visualize the right auricle, showing you the opening for IVC. This is the right ventricle. Here is the posterior interventricular septum. Since it is on the posterior surface, this groove is given the name posterior interventricular septum. This is the opening for IVC. Yes. Now let us begin the autopsy method, autopsy technique. So for the right side of the heart, to enter into the right chambers, you enter the main point, entry point is from the IVC. IVC is the entry point. Initial cut is made in the IVC. You enter through the posterior surface of the heart. From the posterior surface, through the IVC, you enter into the right auricle or the right atrium. And being on the posterior surface, you cut through the posterior tricuspid leaflet. In between the right atria and right ventricle is the tricuspid leaflet. This is the posterior leaflet. You cut through the posterior leaflet and enter the right ventricle. This is the right ventricle. Cutting through the posterior tricuspid leaflet, enter the right ventricle. And you extend this incision parallelly and laterally, 1 centimeter lateral to the posterior IVS and laterally and parallel to the posterior IVS. You extend this incision as far as you can till the apex. This is the inflow. Inflow is from the IVC, from the inferior vena cava, enter into the right atrium. From the right atrium through the posterior tricuspid leaflet, enter the right ventricle, running parallelly lateral to the posterior IVS, posterior interventricular septum, as far as possible till the apex. To come out for the exit point, for the outflow, you extend this incision, you curve it towards the anterior surface. Here it comes out here like this. It comes out like this, and this incision too, it runs parallelly to the anterior interventricular groove, interventricular septum. This is the anterior interventricular septum. So this incision runs parallelly and laterally, 1 centimeter laterally to the anterior interventricular septum. While being within the right ventricle, this is the right ventricle, while being within the right ventricle, you find the pulmonary cusp. Here is the pulmonary cusp. It has anterior and posterior pulmonary cusp. You cut through the anterior pulmonary cusp and enter into the main pulmonary branch. This is the outflow. For the inflow, I'll show you in this representation. It follows the direction of blood flow. This is the IVC. You enter through the IVC into the right atrium, the right auricle or the right atrium, through the posterior tricuspid leaflet, cut through the posterior tricuspid leaflet, you enter into the right ventricle, parallelly 1 centimeter lateral and parallel to the posterior IVC, you run parallelly as far as possible till the apex. For the outlet, you extend this incision onto the anterior surface, and this too runs parallel to the anterior interventricular septum. Cut through the anterior pulmonary cusp, enter the main pulmonary branch. That's it. This is the exit for the right side of the heart. For the left side of the heart, let us see the basic anatomy. This anterior surface of the heart, it shows you left atrial appendage, left ventricle. This is the anterior interventricular septum. This is the ascending and the arch of the aortas. There are two sets of veins. These are right and left pulmonary veins. There are two pulmonary veins on each side, upper and lower pulmonary veins on each side. So this is the posterior surface. You can appreciate the left ventricle here. This is the posterior interventricular septum. This is the left atrial appendage. It shows you four openings here. Right and left sets. These are right lower pulmonary vein. This is the left upper, left lower pulmonary veins. So let us begin with the left side of the heart. So initially the cut is made in the left atrium, in between the right and left upper pulmonary veins. This is the right and left upper pulmonary veins. Initial cut made in between these two pulmonary veins, and it can be extended in between the upper lower pulmonary veins on each side. Between the upper and lower veins, you extend this cut. You also extend this cut into the left atrial appendage to check for any mural thrombus. And the same incision is extended onto the inferolateral aspect of atrial wall. This is the atrial wall. This is obviously the inferior surface. The posterior surface itself is the inferior surface, and it's a inferolateral aspect of the left atrial wall. And you extend this cut, staying posteriorly, you cut through the posterior bicuspid valve, posterior mitral valve. You cut through the posterior mitral valve, enter into the left ventricle. You are entering into the left ventricle. Left ventricle has two papillary muscles, two sets of papillary muscles. In between here, you extend through left atrial appendage, extend through the posterior bicuspid leaflet, enter the left ventricle. It has two sets of papillary muscles. Cut in between the two papillary muscles, enter into left ventricle on the posterior surface up to the apex. This is the inflow of the left ventricle. For the outflow, in a similar fashion like right side of the heart, this incision is extended towards, this incision towards the anterior surface. It comes out like this. Similar fashion like right side, this incision too, it runs laterally and parallelly to the anterior interventricular septum. So staying within the left ventricle, you can find the aortic openings. This is the aorta. The aortic opening is here. Aorta has right and left aortic cusp. Cut through the left aortic cusp. You will cut through this left aortic cusp, enter the ascending aorta, and eventually the arch of the aorta. So you should take care not to cut this anterior mitral leaflet or the interventricular septa. Let us see in this diagram of the blood flow. So here you can visualize there are two sets of pulmonary veins, right, left, upper, lower pulmonary veins. Initial incision is given in between the right upper and lower veins. Extend this in between upper lower veins on each side. Take this incision laterally towards the left atrial appendage to the inferolateral aspect of the left atrial wall. Cut through the posterior leaflet or bicuspid valve, enter the left ventricle. In between there are two sets of papillary muscles. Cut in between the two sets of papillary muscles till the apex. And further, this is the inflow. For the outflow, you extend this incision, curve this incision over the anterior aspect, running 1 centimeter. So this incision, it is curved here, running 1 centimeter parallelly and laterally to the anterior IVS. You take this cut over the anterior surface of the left ventricle. Staying within the left ventricle, you find this is the aortic opening. In the aortic opening, this left aortic cusp. Cut through the left aortic cusp, enter into the ascending and eventually the arch of aorta. So this is the entry and exit of the left side of the heart. Thank you everyone.